Well, it happened in January, in the beginning of January. Actually, it was the day she closed on a brand new house. That evening, she was in the bathroom with her granddaughter, combing her hair, and just passed out.
Stroke was terrible. I couldn't move, couldn't walk, and couldn't talk, couldn't speak, nothing.
She was in rehab for approximately 2 weeks where they were teaching her how to walk again. It was a difficult experience for the family as well as for her. The frustration when she couldn't think of a word, she would just get frustrated. So she was kind of lost, captured in her own body pretty much. At that point we researched stem cell therapy and decided, we should give that a shot. Read a lot about it, and we found NSI stem cell, and we took her. I think it was in March.
When it comes to Adele, and when we first met with her, she was about 6 to 8 months post stroke, and she had just gotten out of rehab, and her family was very motivated to make some change with her, and they elected to do stem cell therapy with us. So we brought her in and we harvested stem cells directly from her body. We isolated them on her behalf, and then we made the injections. It's an intrathecal injection, as I described. When we apply stem cells for brain tissue or for central nervous system, the important thing to understand is that it's too risky to inject above the L2 level. In Adele's case, because of the extensive brain damage that she suffered as a result of her stroke, we wanted to get as many stem cells into brain tissue as we possibly could. So we took this route in terms of an intrathecal injection. And the reason why is because it's safer to inject in the lumbar spine where there's no sensitive neurological tissue that we risk injuring. And that's what we did with Adele, so that we can deliver the dose of stem cells directly to brain tissue. And with her, we saw some dramatic improvements right after even the first dose. She was immediately able to, hold a conversation. She was immediately able to interact with her family and remember, her family members, which was really kind of an amazing thing.
I was impressed. I didn't, I knew it might work, but I never thought to that degree. And it's amazing. It's amazing. Within 2 weeks, she was actually speaking better, remembering, walking better. Now walking with a walker, much long distances. She definitely communicates better. She remembers everything, that happened. And her neurologist, when she first came out of this, told me that she would never remember anything. She would never learn anything. And he didn't see any positive outlook or prognosis at all.
With the stem cells, it got so much better. I could speak, I could walk. It's wonderful. If I didn't get that, I don't know what I would do. I feel great. I feel great. I go out, I go to casinos, I go everywhere now. It's like I couldn't do nothing. NSI helped me 1,000 times better. I couldn't be walking, I couldn't be doing anything.
What we've been able to provide for her is nothing short of amazing, and it makes us all, that's the reason why we get out of bed in the morning. That's the reason why we do what we do, is to help individuals on that level. What's important to understand is, we didn't do the work. At the end of the day, the stem cells that are present in our bodies are very powerful, and they do have the ability to heal and regenerate tissue, and our job is simple. Our job is to obtain those in abundance and apply them on the patient's behalf in an effort to heal and in an effort to achieve health. And that's what we did with her, and that's what we do with all of our patients.